Welcome back to Urgent Care Unscripted. I'm Barbara Ronalter, Director of Operations and Business Development for AFC Urgent Care in West Haven.
And this is Muhammad Zaman. I'm the franchisee and owner of the AFC Urgent Care in West Haven. Today we are here to talk about a very common topic, physical or annual physical. The question is, what is really an annual physical? What happens at an annual physical? What kind of annual physicals are there? Does it really have to be annual? And which of the physicals that do we really perform at the urgent care in West Haven?
That's right. And I think most importantly, what is covered by insurance? And let's clear that up. I think there's some confusion when it comes to physicals in general.
Yeah, so let's first define what is a physical. So it's as simple as it may sound. It's a annual routine checkup where you come in and the provider performs some tests on you. Provider takes your vitals, takes your blood pressure, checks your sugar, and based upon your conditions, could perform other tests. And there you go. That's the whole breadth of a regular physical. But then there are different kinds of physical that Barbara will now get into the details.
Exactly. So not all physicals are created equal. There are many different types of physicals. We can talk about the most common physical, which is your wellness or your annual physical. The annual physical is just a complete wellness checkup, and that covers everything from vitals to mental health checkups, and it usually is covered by insurance, although that's not always the case when it comes to an urgent care. So they are always covered up at a primary care's office, but some insurances do not cover them at an urgent care. So definitely call your local urgent care or us, and we can answer that for you depending on your insurance. The second type of physical are your annual wellness visits. Those are for Medicare patients, and they are covered under Medicare Part B. Again, that is covered by insurance, not always covered at an urgent care. The third type of physical is your DOT physical. So those are for your CDL drivers. So if you're a CDL driver, I'm sure you're very familiar with this physical. It is a typically every 2-year physical, but it can be that depending on your medical history, you might be required to come in every 3 months, every 6 months, every 1 year. It's really going to be dependent on a couple of things like your blood pressure, your sugar or glucose, and so on.
And CDL stands for Commercial Driving License.
Yes,
right?
Commercial Driver's License. Thank you, Mohammed.
Yeah.
The next physical is school physicals. So those are typically yearly that the school requires, and it's to make sure that all of your vaccines are up to date. We do have them at the urgent care, and they are not covered by your insurance, typically not covered by your insurance, mostly not covered by commercial insurances. So those are your basic health checkups. You can, if you are coming in for your annual physical and you know that you need a school physical form filled out, that usually can be done on the same visit as well. So just check with your provider again on that. The next is your sports physical. So if your kid or you is joining a sports team, you might need a physical done for that to make sure that you are up to par in order to join the team and make sure that you're not going to get any of your teammates sick. Your next one is your pre-op physical. So pre-op physical is really clear, pre-operational. So if you're getting an operation, most likely your surgeon's going to require that you get a clearance from your provider. Typically, you can come to an urgent care, your primary care doctor, and we'll be able to clear you for your physical. Those usually involve blood work as well. So they are not something that we can do same day. So you come in, we get blood work drawn, it gets sent to the lab gets it back to us with your results, and then we clear you for your physical. And those are usually covered by insurance because they are necessary. So I think we covered all of the physicals, and those are the difference between the health necessary physicals versus your administrative physicals. Oh, and I forgot to mention your immigration physicals. So immigration physicals are for immigration patients that are applying for immigration process, whether that's citizenship or visa or your green card. And those are also not covered by insurance. They are administrative physicals. They do require vaccines, and they also require blood work.
And as you have heard from Barbara, some of these physicals are really not annual. Some of them are required by work, so you do it one time when the work is required. Some of them are for a surgery, you do it one time. But then as healthcare becomes a journey and you want to take care of your health and you want to be in control, that's where annual physical comes in, and you have to be proactive about it and schedule your annual physical and come and visit us for those purposes. Whichever physical you're trying to perform, a few things that you have to keep in mind as you walk in through our door. One is you have to have your insurance card, you'll have to have your photo ID, you'll have to have your medications that you're taking, and also share with the provider any medical history that you want them to be aware of.
Yeah, absolutely. And lucky for you, we can do all those physicals at our urgent care in West Haven. Again, like Mohammed said, make sure you bring the correct forms. A lot of those require paperwork. So make sure you're bringing those forms with you, especially if it's a work physical or a sports physical, a school physical. They have very specific forms that they want you to fill out. So quick breakdown, annual physicals are covered by insurance. Medicare annual physicals are also covered by insurance once a year. Those two are once a year. DOT physicals, school physicals, sports physicals, immigration physicals, work physicals, pre-employment physicals, they're not covered by insurance, and pre-op physicals are.
Awesome. At the end of the day, our goal is to make it easy for you. Our goal is to make it as predictable as possible for you, so the whole overall process goes smooth, and you come in, you complete the process, and you leave with a peace of mind and the paperwork that you need.
Absolutely. And we have really good pricing for you. So for those physicals that are not covered by your insurance, we have self-pay pricing that is extremely reasonable. So, and usually a couple of times a year, we might have some, promotions going on. So definitely call us if you're interested, or if you need one of those physicals. We'll let you know what we can offer you. So just to summarize really quick, know which type of physical that you need, book ahead online, bring your ID and your insurance card, and then always check your insurance coverage. If you're not sure, give us a call.
We wanted to cover everything as it pertains to physicals and the different kinds of physicals. We thank you for listening to our podcast, and we welcome you to join Urgent Care Unscripted again for the next episode. Until then, this is Muhammad.
And this is Barbara Renalter. We are located at 354 Sawmill Road in West Haven. Come see us when you need us.
Thank you.